Welcome back to the YouTube channel. Today we're going to be talking about a very common procedure for chronic low back pain, which is known as the lumbar median branch block. This sometimes is also known as a facet joint injection because it's a treatment for the lumbar facet joints. Now, what are the facet joints? Essentially, they're small joints connected to the spine, but they're not the discs and the nerves. So these joints help to support the spine. They carry about 1/3 of the load of the spine in a normal person. And these joints have a small nerve branch called the median branch nerve that comes to the joint. So what do patients with facet joint arthritis typically present with? They typically present with low back pain that may go into the buttock, may wrap a little bit around into the groin, but this pain tends to not be going down the leg, which is how we would differentiate it from sciatica. So those tiny little branches that you see there, those small nerves, we can block those nerves to the facet joints and knock out sensation from the facet joint, thereby taking away the patient's lower back pain. This is an outpatient procedure. It's done under X-ray guidance in a facility. These types of procedures are very specific for lower back pain, and what's nice about this procedure is it's not only meant to be therapeutic, it's also meant to be diagnostic. Now, if we do a series of diagnostic blocks, and I'll give you the algorithm here, the way we do it is we do one set of median branch blocks where we're targeting those nerves that you see there, sending the patient home with a little diary to fill out to tell us, how much relief they got. If a patient gets significant relief from a lumbar median branch block, the protocol is usually just to wait and see how they do. If the patient's doing great, I leave them alone. If the pain returns, let's say after 2 weeks, 4 weeks, even a couple months, that shot can be repeated. So normally you would do 2 diagnostic blocks on a patient to sort of make sure and prove that that's where the pain is really coming from. If you have 2 successful lumbar median branch blocks, then you're a candidate for a radiofrequency ablation. And the radiofrequency ablation is a technique where we essentially not just apply a little numbing and cortisone, but we pinpoint those nerves and apply heat to deaden the nerve for up to a year. They do grow back and it can be repeated. So the main indications for this procedure are somebody with chronic low back pain. It tends to be non-radiating pain. Usually the facet joints are easy to identify when you stress them. You ask the person to twist or bend a certain way, you can put pressure on those joints. You can even just palpate the joints and feel if they're tender. So part of the process is to figure out where the pain is coming from. In terms of people where it might be a little more risky, you wouldn't want to do it if there's an active infection or any kind of bleeding issue, but there's very few reasons to not be able to do the procedure. So as we see here, patients in the prone position, everything being done under X-ray guidance. And under X-ray, we can target those median branch nerves, which are the small branches that go to the facet joint. By targeting those nerves specifically, we can pinpoint just the median branch without targeting anything else. So, for example, if you were to do an epidural injection, it's a bit of a shotgun. So it's not giving you very specific information. So what's nice about this procedure and why a lot of times for low back pain, I would start with the median branch rather than doing an epidural is because this will help you to rule in or rule out facet joint as a cause of pain. If you jump to an epidural injection and you get relief, then you don't really know. Is it the disc? Is it the nerve? Is it the facet joint? Epidurals tend to be a little bit more like a shotgun compared to this, which is a very pinpointed shot. You can have varying responses to this. If your pain goes away for days or even longer, that's great. If you get a short-lived response, that's still important for someone like me to know, because even a temporary response, 4 to 6 hours, may be enough proof that the pain is coming from those joints. So a lot of times I'll give patients a pain diary and say, fill this out and bring it back, because otherwise they'll come back and say it didn't work, even though for those 6 to 8 hours they got a tremendous amount of relief. So again, very common procedure. There is a process with this. You start with the median branch, you repeat it if it works well, but it's temporary. If the pain comes back again, then you proceed with radiofrequency ablation. You do want to take it a little easy after a median branch block, so as to not aggravate the joints. I mean, personally, I'm okay with driving. Typically, these are done awake with a little bit of numbing medicine. You can be sedated for the procedure. Afterwards, recovery is not bad. You can ice it, you can take anti-inflammatories, but you're not going to be laid up from a procedure like this. To target both sides of the lower back, though, we usually do 3 spots on each side, so it could be 6 spots altogether. And then I let patients return just to their regular activities and ask them not to get involved in too much heavy-duty activity until we've had a chance to see it work. I do ask patients to get back into therapy afterwards if they were doing PT. As far as risks of a procedure like this, anytime you put a needle, small risk of bleeding, small risk of infection, chance of causing a nerve injury or something like that is pretty remote. But it's the same risks as any of the pain injections that we would do, epidurals and whatnot. So nice procedure for low back pain, very useful from a diagnostic standpoint. Can be done easily as an outpatient awake and can really help to make a diagnosis as far as where the pain is coming from and set you up for a possible radiofrequency ablation if the pain persists. I hope this information was helpful. Please like the video. Please subscribe for more videos. If you plan on leaving any comments, please don't specifically reference yourself for patient medical privacy reasons. So speak generally on there if you have any questions. Thank you for your time. I appreciate it. Please like the video. Thank you.